Guys, let's quickly review this, okay? So, as we said, okay, this is kidney right here, and this is a ureter, which is actually bringing the urine and draining into the urinary bladder, okay? And the most importantly, you guys always remember is that the histology aspect of the urinary bladder, okay? The mucosa is lined by transitional epithelium, or also called urothelium, okay? Because this transition epithelium, they secrete glycoaminoglycans, which prevents from bacterial growth, okay? That's what it is. And remember, the most important features of this urinary bladder is that they contain this muscle, which is a detrosal muscles, okay? They have receptors, which are called stress receptor. They're very, very important, all right? Now, this ureter, okay, the way the urine passes from the kidney is through the peristaltic contraction, right? Now, even this ureter has a transitional epithelium, okay? That's what it is. And they do have a supply to parasympathetic, sympathetic, okay, which enhances the activity of the peristaltic contractions of the ureter. Now, whenever we discuss about this guy, okay, this urinary bladder is not filled. Let's say it's empty. So whenever it is empty, okay, or let's say there's less urine, that means we don't need to go to the bathroom, right? So in that case, what is going to happen here is that there's a less stretch on this receptor, okay? So whenever there's a less stretch on this detrosal muscles, there's a less impulses is going to your sacral regions, okay? And from the sacral regions, whenever the less is going up, that's going to give a couple of fibers here. One fiber that's going to go bring those, okay, signal, this ascending fibers, and stimulate the sympathetic neurons, okay? And those sympathetic neurons is going to stimulate the activity of the hypogastric nerves, okay? And that is going to work onto this detrosal muscles, okay? Because they have this hypogastric nerve has this beta-3 adrenergic receptor, okay? And where in the beta-3 adrenergic receptor, they release norepinephrine, causing the hyperpolarizations of the cells, okay? Causing relaxations of your detrosal muscles or your urinary bladder, right? Not only this hypogastric goad comes here and work onto this internal urethral sphincter with the alpha-1 adrenergic receptors, releases norepinephrine and causes the contractions of this, okay? So that way, these guys are relaxed here, there's a constrictions here, okay? Not only that, the fiber, this ascending fiber goes all the way down, okay? Relay the signals to this pontine stress centers and also to the prefrontal cortex, okay? And from the cortex of the nervous center that gives the signals back, relays some of the signals to this guy right here, which is the pontine stress centers. And from there, all the fibers all the way come down here to the sacral regions, okay? And what is going to happen is that in the sacral region, they are going to stimulate, okay? They're going to stimulate this guy right here, which are the somatic neurons, okay? These are somatic, and these somatic neurons, okay, they give a rise to this nerve, which is called pudendal nerve. This is a somatic nerve, okay? This pudendal nerve comes here and binds with this external urethra sphincter, because this external urethra sphincter contains the striatal muscles, scaleral muscles, okay? Binds with the nicotinic type of 1 receptor, because that's the receptor present here, and releases acetylcholine, causing the further contraction, okay? So that way, this is relaxed here, this is what? This is contracted here, this is contracted here, so that urine does not pass out. But let's say if there is, the urine is, let's say, collecting here, and that's whenever the urine is, high amount of urine is there, what is going to happen? That's going to cause a stretch on these receptors right here. That's going to give a stronger electrical impulses to this pelvic nerve, which is a parasympathetic nerve, which is bringing afferent signals and bringing to this, look, in the dorsal horn, right? From there, it's going to give it's going to synapse here and go all the way down to after the synapse of the posterior horn, it's going to go all the way down. It's going to bypass this lumbar regions and go all the way down, bypass cervical, and it's actually going to go to the periaqueductal gray first, okay? Then going to go to this prefrontal cortex, okay? Or the cortex of the nervous system like anterior cingulate, even insula, okay? And from the fiber is going to come down, okay? Then that's going to give signals to what is this called? Periaqueducal gray. From the periaqueducal gray, that will give signals or give impulses to this to this center, which is called pontine micturition center, okay? And from the pontine micturition center, as this fiber comes down, first it's going to work with this lumbar regions. What is going to happen is that it's going to relay signals to this sympathetic neurons, okay? And it's inhibitory signals to this sympathetic neurons, okay? Causing sympathetic neurons to get inhibited. So that way, there's no longer relaxation happens here, okay? Or there's no longer contraction happens in the internal sphincter, okay? Not only that, it also comes all the way, this interferer comes all the way down here, and it relays signals to this neuron that has to do with the parasympathetic fibers. It gives a signal to parasympathetic fibers and it stimulates, okay, these parasympathetic neurons, parasympathetic nerves, okay. This nerve is specifically called pelvic nerve, which this parasympathetic, which gets synapsed here at the pelvic ganglion, then the post-parasympathetic nerve, pelvic nerve, that's going to go and to do these trochlear muscles, okay. And what is going to happen? It's going to bound with this M3 receptor, which is a muscarinic receptors, and releases acetylcholine there, causing the contractions of this detrusor muscles, right? Not only that, this pelvic nerve also go down here, okay, on the internal urethral sphincters, and what happens? Stimulates that, causing this nitric oxide release and cause the relaxations of this internal sphincter, okay? And not only that, that's what is happening, right? But not only this descending fiber that is coming from the pontine micturition centers give a signal to parasympathetic fiber, but also it gives inhibitory signals to the somatic neurons, okay? If you give inhibitory signals to the somatic neurons, which is the pudendal nerves coming from S2, ST4, what is going to happen? There's less signals is going to this external urethral sphincter, meaning that there will be, okay, there will be no contraction, because if there's no stimulations here, okay, this powerful stimulation, what is going to happen? This is going to start relaxing, okay? So there will be relaxation of external urethral sphincter muscles, okay? So then after that, what is going to happen? You just void, all right? That's what it happens. Now, quickly, let's talk about this, okay? You know, some of the conditions, conditions like, for example, like there's in a man, they have this, what is this called? The prostate gland, right? Sometimes there's a prostate hypertrophy, okay? When the prostate hypertrophy is there, that can cause this, as this get bigger, that can cause this urethra to constrict, okay? And that can, result into incontinence. Okay, that's what's going to happen, okay? Even sometimes, let's say there's a stone, because these are called pelvic beam here, okay? If there's a stone is present here, okay? And then it causes, so that way the urine cannot pass through, okay? That means what is going to happen? That is, the urine is not going to feel, okay? So you're not going to have basically that's going to result into also the incontinence, okay? That's also what it is. So there are different clinical conditions, okay, that is associated with this micturition or voiding, okay? But I'm not going to discuss about that right now, because we'll talk about it in pathology, okay? But this is a physiology aspect of your micturition reflex, okay? So guys, I hope that I made it very clear to you guys. Please, as usual, don't forget to subscribe my channel, and please share, comment, and like it. All right? Thank you. Have a good day.